Let's listen to an expert doctor, Dr. Vishal Pawal, MBBS, MD Medicine, DNB Cardiologist Mumbai, Senior Consultant and Interventional Cardiologist, Chaitanya Heart and Brain Center, Mulund West, Mumbai. For hypertension in young population, along with coronary artery diseases, higher heart rate can be sure of a happy heart. Sir, how do we define hypertension and when should we conclude that the person has a hypertension?
Hypertension basically means there is an increase in the blood pressure. So there are two types of blood pressure. The upper one is systolic blood pressure and the lower one is diastolic blood pressure. The normal blood pressure systolic is around 120 millimeters of mercury and normal diastolic blood pressure is around 80 millimeters of mercury. So anything beyond that we call it an increased blood pressure. But to define as an hypertension, the upper blood pressure, that is the systolic blood pressure more than 140 millimeters of mercury and lower blood pressure more than 90 millimeters of mercury, we define it as an hypertension. At this blood pressure range, you should seek medical help.
Sir, what is the relevance of heart rate in hypertension?
Heart rate is basically at how many times your heart pumps blood each minute. Normal heart rate is around 60 to 90 beats per minute, which is a normal. Any heart rate beyond 90 beats per minute, we call it an increased heart rate. We call it generally as a tachycardia. So patients who have baseline increased heart rate are at risk of developing early hypertension in future. The patients who are already diagnosed as an hypertension and who are already on the medicine, if there is a presence of increased heart rate, at major risk of developing complications related to hypertension. Basically, there is an increased rate of complications related to heart and brain in the patients who are on medications for hypertension and who have associated increase in the heart.
So what precautions should a patient take along with medications?
Making healthy lifestyle choice is an important part of treatment. It can help you to bring your blood pressure under control. This may include losing an extra weight, eating meals with less fat and salt, or limiting your alcohol intake, starting in regular exercises, which may include cycling, walking, jogging, or swimming. And if you are a smoker, you should quit smoking as immediately as possible.
Public awareness initiative by Glenmark Pharmaceuticals.